Hello everyone, my name is Xiaolu Ma. Today we are going to talk about obtaining informed consent. Last section, we learned the information essential for consent. And in this section, we will learn the rest contents. Informed consent implies not only the imparting of information by the researcher, but also the comprehension of that information by the subject. Potential subjects' comprehension of the consent depends on time pressure, literacy, language, the complexity of the study, and the clarity of its explanation. Consequently, healthcare facilities may require that the researcher make the consent form available in the most common languages spoken by their patients. Thus, the consent information must be written and verbalized in lay terminology, not professional jargon, and must be presented without the use of biased terms that might coerce a subject into participating in a study. One likely that some subjects may have limited reading ability, the researcher may read the consent aloud to all subjects to avoid embarrassment. In qualitative research, participants might comprehend their participation in a study at the beginning, but unexpected events or consequences might occur during the study to obscure that understanding. Thus, informed consent is an ongoing, evolving process in qualitative research, even though it does not involve actual signature of new consent forms to accompany its change in focus. The researcher must verbally renegotiate the participants' consent and determine their comprehension of that consent as changes occur in the study, discussing involving information and re-questioning their participation in verifying and exploring new information. Autonomous individuals who are capable of understanding and weighing the benefits and risks of a proposed study are compelled to give consent. The researcher may assess the competence of the study by using a formal assessment of decisional capacity. As learned earlier, diminished capacity to comprehend it may be related to a subject's health, age, or educational status, and in hospitalized patients may be transient and related to treatments and medications. However, when this is the case, the researcher makes every effort to present information at a level prospective subject can understand, so that they can consent or assent to the research, whichever is appropriate to their status. In addition, researchers need to present essential information clearly for consent to the legally authorized representative, if one is required, such as the conservator, parent, or guardian of the prospective subject. Voluntary consent means that the prospective subject has decided to take part in a study of his or her own volition without coercion or any undue influence. Voluntary consent is obtained after the prospective subject has been given essential information about the study and has shown comprehension of his information. Researchers need to ensure that their persuasion and compensation of prospective subjects are not causing. The standard is that informed consent is presented formally and requires the signature of the subject and a witness. There are low-risk studies, however, in which signature and/or written consent can be waived with the approval of the IRB. The subjects must be given the option of signing or not signing a consent form, and the subject's wishes govern whether the consent form is signed. However, the four elements of consent, disclosure, comprehension, competence, and voluntarism, are essential in all studies, whether written consent is waived or required. As a researcher object, individuals have the right to authorize the covered interests. For example, medical service providers, health plans, and medical information clearinghouses to use or disclose their protected health information for research purpose. The authorization information can be included as part of the consent form, but it is probably best to have two separate forms. And there is a sample consent form from Birth and Groves, the practice of nursing research, words in parentheses and boldface identify common essential consent information and would not appear in an actual form. Based on the sample consent form, you can try to write an informed consent. That's all for this section. Thanks for your time.